So good afternoon. My name is Atul Kukar. I'm the Chief of Cardiology at Mount Sinai Queens, and I've been here at Mount Sinai Queens for 3 years, and I'm board certified in cardiovascular medicine and interventional cardiology. I have a special focus in my practice on both cardiac and vascular disease. It is a true honor to be here to talk about a topic very near and dear, I think, to all our hearts, Go Red for Women, with the focus on women and heart disease and vascular disease. So Go Red for Women promotes awareness of women and heart disease. It challenges women to recognize the symptoms of an acute cardiac event and take action to reduce their heart disease risk. Mount Sinai Queens is proud to collaborate with Mount Sinai Heart, the American Heart Association, and other clinical departments throughout the hospital to join in this campaign to educate and raise awareness to our patients, community members, and staff on how to maintain their cardiovascular health. It is my pleasure to introduce Preethi Pirlamarla, who is going to introduce herself, and she's going to join me in the talk today.
Thank you very much, Dr. Kukar. Good afternoon. My name is Preethi Pirlamarla, and I am one of the heart failure specialists here in the Department of Cardiology at Mount Sinai Queens. I am board certified in advanced heart failure, cardiovascular disease, and cardiac transplant, and I'm very excited to share this presentation with Dr. Kukar in cardiovascular disease in women and my particular interest, which is heart failure and how it presents and how to manage it in women. And I'm pleased to share this with you going forward.
So just so you know who we are, if you can't see our faces during this presentation, I'm going to go over the quick outline of what we're going to talk about today. Go to the next slide. So we're going to talk about coronary artery disease, which is blockages of the arteries that supply blood to the heart muscle, specifically with the focus on presentation in women. We'll talk about the risk factors for heart disease. We'll talk about pregnancy, menopause, and postmenopause, some risk factors that often get overlooked. We'll have a brief discussion on prevention, and we will end with healthy lifestyle, including exercise and mental health tips and tricks from our side. We are very happy to have Dr. Pirlamarla here with us today so we can actually do a special focus on heart failure in women as well. So just to give you some background on how bad heart disease is in women, it's the #1 killer in America for women. More women die than men do of heart disease every year. It also claims more lives than all cancers combined. 2 out of 3 women who die of heart disease also have no warning signs. This is real. This is very scary. This is things coming out of the blue. This is things coming out of left field. So I put this graphic up just to give you an idea and put things into perspective as to how bad heart disease is in America. If you just take a look at the things that you think may cause more deaths, such as auto accidents or war, you can see that heart disease is the #1. The only thing I would make one caveat is infections has changed, and it does take a more higher role now between respiratory disease and cancers, but heart disease still remains the #1 killer of men and women in America. So what is a heart attack? First, a heart attack is quite common and occurs every 45 seconds in America. It is caused by plaque buildup. Plaque is usually made of cholesterol and fat. It builds up in the walls of the arteries over many decades. So this is not a disease just when you're in your 40s, 50s, 60s, and 70s. This starts in your teenage years. And we know this from the Korean War and autopsy reports done on young men that died, and they've already developed fatty streaks in their late teens. So this starts young, but then it's accelerated by things like diabetes, smoking, high blood pressure, high cholesterol, genetics, which we can more easily say is a family history of having heart disease in a relative at a young age, a sedentary lifestyle, and often along with that goes obesity. Now, these are the risk factors that we need to concentrate on, and these are the ones that we need to modify to reduce the chance of a heart attack. So what exactly happens when a heart attack occurs? Blood flow to the heart muscle is either severely reduced or blocked, and that's when a heart attack occurs. So the plaque that's built up over decades either somehow opens or tears, and that causes the body to attack that tear with things like platelets, and that causes a blood clot. Just think about what happens when you cut yourself on your skin. You can develop a scab. Now imagine that happening inside of a blood vessel supplying the heart muscle, and that is what a heart attack is. So this slide is one of the most common depictions you see of a heart attack, and I'm going to point out something that really bothers me. There's a beard, which makes it a man. And you see the most of the pictures that we look at when it talks about what does a heart attack feel like, or what are the symptoms of a heart attack, depicts a male. And I think it's time we started changing how we look at it. So I put this up there to say, yes, the number one most common symptom in men and women is pressure, heaviness, or squeezing in the chest, but it is not the typical presentation for women in general. Next slide. So the American Heart Association came up with this depiction, which is nice and simplistic. So it does take, pain or chest discomfort as the number one most common sign, but it does talk about a lot of the other warning signs, which unfortunately we have not done a great job about educating society in large about. So you can have lightheadedness, nausea, vomiting, jaw pain, neck pain, discomfort in the pain, arm or shoulder, as well as simply shortness of breath. Now, I put up the next slide to talk about that there's some different places where women will present much differently than men. Upper body pain in the neck, back, or jaw, cold sweats, unexplained fatigue, and even something just like nausea and vomiting with abdominal discomfort. These are not considered to be classic signs of a heart attack, but truly they actually are classic signs, just more in women than in men. There's also some additional female-specific cardiac risk factors. Obviously, a man is not getting pregnant, so a lot of these revolve around pregnancy and menopause. So there's preterm labor, that's before 37 weeks. There's gestational hypertension, which is high blood pressure during your pregnancy or shortly after your pregnancy. Gestational diabetes, which is the same thing, poor blood sugar control, either during or just after your pregnancy. Preeclampsia, which is often a syndrome of having high blood pressure during the pregnancy with some other lab abnormalities. And then breast cancer treatment, specifically some of the chemotherapeutic drugs, and many years ago, some of the radiation they used to treat breast cancer does accelerate heart disease. And then menopause status, which we're going to talk about a little bit later. Or right here. So menopause, which usually happens the average age around 54, but we clearly know that with hysterectomies and variations in races and cultures that sometimes it happens younger, sometimes it happens a little older. And what happens is estrogen is greatly reduced, and estrogen is a natural hormone which is cardioprotective. So it helps keep blood pressure low. It helps keep the balance of your LDL and HDL, which is your bad and good cholesterols, more in line. And unfortunately, we once thought that replacing estrogen when a woman hit menopause would help. But one of the largest studies we have to date showed that it actually may be harmful. They are reinvestigating this, and estrogen may come back in different forms, but for right now, it's considered to not be utilized for any kind of prevention of heart disease. And so among women, what we look at is once a woman hits menopause, the risk of having a heart attack greatly increases the 10 years after. And I usually say that 5 years after menopause, the risk of a heart attack in a woman and man is now equivalent. Let me go to the next slide. So I wanted to keep it simple, and I think simple is the key here. So this is Life's Simple 7 from the American Heart Association. And you can see the diagram depicts 7 steps to make or reduce the risk of heart disease. And let me just add something here. This is also vascular disease. We're not just talking about heart attacks. We are also talking about strokes, which is a major problem as well. And I think also gets underappreciated in women. So manage blood pressure, control cholesterol, reduce blood sugar, get active, which is something I think that our society needs to do more of, eat better, lose weight, and of course, I would say stop smoking is incredibly important as well. Just to depict it a little easier, next slide, we're looking at what are the advantages of doing all these things. So on the left side, you have the menu, so to speak, of what are health factors that can be addressed. And on the right side, we see what actually the numbers are. So the 48% lower stroke risk for patients who are in optimal health. But optimal health may not be attainable for everybody. But there's a 27% lower stroke risk for people in average health. And that seems to be probably the best target for us to get to. And for every point you do to increase your health score, which is based on activities on the left side, you get an 8% lower risk of stroke. So I'm going to pass this on to Preethi now. Dr. Pirlamarla is going to talk about heart failure as well as some other ways of risk modification. And most importantly, how and what to talk to your doctor about.
Thank you, Dr. Kukar. So just to switch gears a little bit, so let's start off with what exactly is heart failure. So in broad strokes, heart failure is a condition in when the heart loses the ability to pump enough blood to supply the organs of the body. And when we discuss heart failure, there's two broad categories that heart failure can happen. The first one is when the heart becomes progressively weaker and then becomes unable to pump blood to the rest of the body. You might hear this as heart failure of reduced ejection fraction or heart failure of systolic dysfunction, meaning the heart really can't mount the effort it needs to in order to pump blood. The second category is when the heart can become stiffened over time and it becomes unable to fill with blood, and that causes it to lose the ability to pump effectively. And you might hear this sometimes as heart failure with preserved ejection fraction or heart failure with diastolic dysfunction. Regardless of the mechanism of heart failure, in both scenarios, what can end up happening is that you can have a retention of fluid, also known as congestion, and that is where sometimes you might hear of congestive heart failure. The important thing to note is that heart failure is progressive. Over time, the heart function can get worse if you don't have appropriate treatment. So how common is heart failure? When you actually look at the numbers, it's actually quite staggering. So we are now calling it an epidemic in the United States. And when you look at how many people are diagnosed, you see that 6.5 million people over the age of 20 carry the diagnosis of heart failure in the United States. And we are estimating that there's over 900,000 cases of heart failure that are diagnosed every single year. It accounts for about 8.5% of all heart disease deaths in the United States and about 36% of all cardiovascular deaths. It really is quite impressive when you see how common heart failure is and how much of a impact it has on patients with cardiovascular disease. And you also see that it's probably one of the most common causes of hospitalizations in the United States. So who can get heart failure? So there are a few categories of people who are at an increased risk of developing heart failure. So the first column is people who already have some form of pre-existing cardiovascular or cardiac disease. Those with coronary disease, which Dr. Kukar already had outlined, in which there's fat deposits that create blockage in the heart arteries. Those who have suffered a heart attack or a myocardial infarction in the past. Those who have damage to the heart valves, and this is known as valvular heart disease. Those who have an enlarging and weakening of the heart muscle, which in a broad definition is known as a cardiomyopathy. Those who have heart defects at birth, known as congenital heart disease. And those who have a family history of heart failure, and that's known as a familial cardiomyopathy. And on the other column, we see that there are people who, even if they don't have pre-existing heart disease, still run the risk of heart failure. And these are patients who are obese, those who have sleep apnea or severe lung disease, because we know that it can create an increased amount of strain and pressure on the heart, those who have high blood pressure, and those who have diabetes. And what we know is that heart failure has profound effects in women. About 3 million American women carry the diagnosis of heart failure in the United States. And of the 900,000 new cases that are diagnosed every year, more than half of those are in women. And women die from congestive heart failure more often than men do, accounting for 56.3% of heart failure deaths. And to echo what Dr. Kukar said, it's pretty scary and it's quite impressive the impact that heart failure can have on women. Heart failure also presents differently in women, just like all other cardiovascular diseases. Women tend to develop heart failure at an older age than men. Heart failure in women is more often caused by the stiffening of the heart as opposed to weakening of the heart. And the most common causes of heart failure in women are because of high blood pressure, coronary disease, and diabetes. There are causes of heart failure that are very specific to women, and one of those includes peripartum cardiomyopathy. It's a very rare case of heart failure in which the heart muscle weakens during the late stages or right after pregnancy. And so it's very specific to women and something that we definitely watch out for. And another important thing to note is that depression is frequently diagnosed in patients with heart failure, and is more common in women than in men. So what are the symptoms of heart failure? So we like to use the acronym FACES, which stands for fatigue, activities limited, chest congestion, edema or swelling, particularly in the ankles, or shortness of breath. And we break down these into further subcategories. When we talk about fatigue, we mean, do you tire more easily? Do you just feel overall more fatigued and can't perform your general activities? Are you noticing swelling in your legs or ankles? When we talk about breathing difficulties or shortness of breath, are you getting short of breath from just doing simple activities such as walking the stairs, or not able to catch your breath after doing things you normally are able to do? Some telling symptoms are, do you wake up at night feeling like you can't breathe and you have to catch your breath? Or do you need more pillows to sleep comfortably at night? Because if you try to lie flat, you're having difficulty breathing and you feel that you need to prop yourself up. Or coughing. Are you having frequent episodes of coughing? And when you are coughing, are you bringing up pink or frothy type sputum? Or when you try to lie down in bed, do you find that all of a sudden you start coughing and you're bringing up the sputum? Keep in mind that coughing is very nonspecific and can be representative of other diseases. And so it's always important to talk to your doctor when you have this symptom, especially in conjunction with the other symptoms that we talked about. So what can you do to decrease your risk? And you'll find that some of these are very similar to what Dr. Kukar was talking about previously. Stopping smoking is the single most important thing you can do to decrease your cardiovascular risk as well as your heart failure risk. Increase your cardiovascular activity and also modify your diet. So what's the recommended amount of exercise? Generally, the recommendations is of 150 minutes of moderate intensity physical activity each week, or 75 minutes of vigorous intensity, or a combination of both. A general rule is that 2 minutes of moderate intensity accounts for the same as 1 minute of vigorous intensity. And for even more health benefits, try to do 300 minutes of moderate intensity or 150 of vigorous intensity each week. Basically, the bottom line is the more active you are, the more you'll find that you benefit from exercise. And just a couple examples of what's considered moderate intensity: brisk walking, aerobics, dancing, gardening, tennis, or slow biking. Examples of vigorous activity include hiking, running, swimming laps, aerobic dancing, heavy yard work, etc. Some key things to remember is when you're doing aerobic activity, do it for at least 10 minutes at a time and try to spread it out throughout the week. And when possible, try to incorporate muscle strength training at least 2 days a week. As always, talk to your doctor before starting any exercise regimen to see what's the safest and what's the best for you. Lastly, how do you modify your risk factors by your diet? Some key things are increase your intake of vegetables, such as greens, broccoli, cabbage, carrots, and fruits, especially those that have a lower glycemic index, such as apples, bananas, grapes, prunes. Try to increase your intake of whole grains, such as oatmeal, brown rice, or fat-free or low-fat dairy products, such as milk, cheese, or yogurt. And try to supplement your diet with protein-rich foods, which include fish, lean meats, poultry, eggs, legumes, and nuts. Basically, the more fresh your diet can be, the better you'll see the benefit. I know this is a lot to take in at one time, but here's some key things to take away from this. A lot of this you should be discussing with your doctor, and how to make the most of your visit is trying to ask some of these questions. For example, what are my risk factors for heart disease and stroke? What are the warning signs of heart disease and stroke? Do I need to lose or gain weight for my health? What's a healthy eating plan for me? What is my blood pressure and is it at a healthy level? What's my cholesterol and is it at a healthy level? Other things to ask is, what can I do to lower my risk of heart disease and stroke? And if you're around menopause, what should I know about the effects of menopause on my health? These are some key things that you can make the most of your doctor's visit and really can go very far in reducing your cardiovascular risk.
Preethi, thank you for that incredible talk. Very informative. And I think our audience is going to really enjoy the lessons learned, and hopefully we can, engage them more as we go forward. So I wanted to let everyone know that if you wanted to learn more about cardiovascular health and the great care that we have at Mount Sinai and Mount Sinai Queens, please visit us at www.mountsinai.org/Queens. We also encourage you to take a selfie of yourself wearing red, post it on social media with the hashtag #GoRedMSQ. It's a great way to bring awareness to women in heart disease, and Go Red for Women. We would like to thank the American Heart Association and Mount Sinai Heart for all their support. Thank you.
Thank you.